Did you know that wearing a small splint at night has been proven to decrease finger joint pain? And not only does it help decrease your pain, but wearing a nighttime splint can increase your finger extension, aka straightening of your fingertip. It can prevent crooked finger deformities, improve your hand function, and if you don't like the look of your finger joints, it can also help the appearance. Plus, there are several research studies that prove nighttime splinting to be a safe and simple treatment option. Hi guys, I'm Michelle from Virtual Hand Care. I'm an occupational therapist and a certified hand therapist of 20 years. And in this video, I'm gonna show you that wearing a nighttime splint can help stop painful joint deformities. And I'm gonna share several options so you can find one that works best for you. Now, your DIP joints, also known as your distal interphalangeal joints, are the most common location to develop osteoarthritis. Your DIP joints and your thumb CMC joints are the most common in your hand. And as we develop osteoarthritis in our finger joints, our fingers can start to laterally deviate or shift, and they can even start to bend or flex. And that's because the foundation of your joint has changed. The cartilage has worn down and there's less space between the two bones. And when you continue to use your hands for pinching and twisting and opening things all day, every day, it can lead to that lateral shift of the joint. Eventually, the ligaments on one side get tight and on the other side get stretched out. But this process can be very painful for many people. Plus, it can affect your fine motor function and strength of your hand. And many people just don't like the appearance of it either. So since you're sleeping at night and likely not using your hands anyway, you might as well wear a splint to work on straightening your finger joint. But because everyone's joints are different sizes and may have different angles of deviation, it could take time to figure out which splints might fit you the best. And because of that, the first option that I want to share with you is a custom nighttime splint fabricated by a certified hand therapist. Actually, research shows that a custom splint worn nightly for 3 months can result in less pain and a straighter finger. So this may be your best option if you've had a crooked or a deviated finger joint for quite some time and over-the-counter splints just do not fit right, they fall off when you're sleeping, or they're just uncomfortable. What I like about a custom splint option is that it can be made from a variety of materials that a hand therapist usually has available to them. Typically, the therapist places your finger in a straighter position and then molds the splint around your finger joint. So when you are sleeping, your finger is supported and not able to deviate or bend like it wants to. And often the splint can be even modified over the course of several weeks as your joint adjusts to the position of the splint, which can be more comfortable and more effective at straightening your finger joint over time. Now, the downside to this is that it can be expensive because it's custom and it may not always be covered by insurance. But to see if you have a certified hand therapist near you to have a custom splint made, then you can visit the Hand Therapy Certification Commission at htcc.org, and I'll link that here. Now, another nighttime splint option to help with finger joint pain and deformity are ring splints. A ring splint can be a custom, semi-custom, and even prefabricated with various sizes available, just like regular rings. Typically, these are made from metals like brass or titanium or silver or gold, but also they can be made in plastic. Rings work by supporting the lateral side of your finger on the opposite side of the joint. So if your DIP joint is deviating ulnarly towards your small finger, then the support is usually on the radial side, which helps to counteract that deviation. And also there are rings that have support on both sides of the joints for instability in both directions. But ring splints are only helpful if you still have some mobility in your finger joint. You likely would not benefit from a ring or even be able to put one on if your joint is too stiff and has been stuck in a deviated position for a really long time. Again, just like the custom fabricated splints that I mentioned earlier, a custom ring can be a more expensive option, but totally worth it because it's specially made to support your joint properly. And one company that has been making custom rings for over 40 years is the Silver Ring Company. Now, I have no affiliation with them, but they were founded by an occupational therapist and they can make any type of ring splint imaginable. Their rings are made of sterling silver, so they will last you a very, very long time. But a certified hand therapist has to measure you using their special Silver Ring Company measuring tool. So that way you get a truly tailored ring that fits over your joint and prevents the deviation and deformity the right way. And a lot of people even like wearing them with day-to-day gripping and pinching activities for the joint pain relief. The good news is there are less expensive custom ring splints available also. You can find Arthritis ring splints on Etsy or Amazon, or even small jewelry shops will make them. But you will need to measure yourself and you must make sure you get those measurements right. And then there are prefabricated options that are made of plastic, such as ovalate rings. And these come in many different sizes and are used on all fingers and thumbs for a variety of different finger injuries and conditions. So the downside is it may not fit your joint properly. You may have difficulty fitting it over your DIP joint if it's too small, but if it's too big, then it could rotate around your finger in your sleep and you could wake up with a sore joint. But if that's your only option, you may need to do some of your own customizing, like wrapping tape around it to make sure that it stays in place and prevents your finger joint from deviating. However, they are the least expensive ring option, making it a great splint to try before you spend the money on any custom splints. Now, keep in mind, since ovalates are used for so many other conditions, they are worn a little differently when you are trying to prevent lateral deviation deformities of your DIP joint. So the oval side should actually push against the deformity. So if your finger is deviating towards your small finger, then the oval is placed on the small finger side, pushing against that deviation. And that's really important to remember because you do not want to make that deformity worse, right? And finally, my last nighttime splint option are single strap splints. The ones I have here are by Ron J. I found these on Amazon and I will link them here and in the description box below. You may be able to find something similar to these near you. They are very inexpensive. You get several of these in a pack. They could be a comfortable starting point for anyone with larger swollen finger joints. They are made of a soft neoprene material and they actually have this really small piece of aluminum to support your fingertip. For this one, I would suggest placing the plate on the palm side of your finger. So to put this on, you want to place the splint on a table. Make sure that the strap is on the side where your finger deviates. Then you want to use your other hand to lift your finger to make sure you straighten your joint as much as you can. Then you want to place your finger on the splint and lightly press down to hold that position. Then you want to pull the strap across your finger in the opposite direction. This will help push your finger joint and counteract the deviation. Now, as I mentioned earlier, according to research, you may need to wear one of these splint options at night for about 3 months before you notice improvements of your fingertip straightening and for consistent joint pain relief. And at that time, you can reevaluate whether you need to adjust your splint, maybe try a different splint, or continue with the same nighttime splint to prevent those painful deformities from occurring again. And finally, you may have noticed that none of these options that I just shared splinted the entire finger. There's a lot of splints out there that are longer and immobilize every joint of your finger, but in my opinion, those do not truly isolate the tip of your finger the right way. Not to mention, you could wake up with your whole finger feeling stiff and painful, unless you're getting something truly customized to fit each joint of your finger. Now, if you found this video helpful, do please give it a like and hit that subscribe button below. And if you're looking for more finger arthritis tips and exercises, then check out these videos here. Until next time, thanks for watching.